I'd like to call our next speaker, who is Dr. Greg Mosdossy, Doctors for Firearms Safety and Responsibility. Welcome. And again, the clock will be on your left-hand side, 4 minutes when you're ready.
Thank you for having me. I'm an emergency physician that works in London, Ontario at the Children's Hospital of Western Ontario. I'm also an associate professor at Western University. I'm also a founding member of a group that we started this year called the Doctors for Firearms Safety and Responsibility. Just a little bit about my background. I was present personally at the Montreal Polytechnic shooting in 1989, where 14 women lost their lives. It affects me still. I had a 2-year-old daughter and a 7-month-old son. At the time, I slept on the floor for 6 months as a result of having been on scene pronouncing the victims dead and taking care of some of the injured afterwards. I'm also a pistol shooter, a competitive pistol shooter, and rifle and shotgun shooter. I'm a range officer in 3 different firearms disciplines. So I have a unique perspective to speak on your point number 6, which is the banning of firearms. I'd like to just clarify that the assault weapons portion of it is, in my opinion, redundant. Assault weapons are weapons that fire in a fully automatic mode with high-capacity magazines. Those are illegal and unobtainable by Canadians legally. They're issued to police and military only. The issue of handguns and semi-automatic rifles, I think everyone probably knows some of the regulations involved in that, taking courses, taking months to obtain your license, having 24-hour background checks every single day by the RCMP, knowing that licensed firearms owners are actually safer in terms of violent crime statistics than the general public, and in fact safer than off-duty police officers. The point I'd like to make with this is that a gun ban actually affects licensed gun owners. It affects millions. Literally, there's 2.2 million licensed firearms owners in Canada. There's many more, probably twice that number, that go out with licensed firearms owners to be supervised at ranges. There are ranges that take public shooting times when people can go and shoot. Many people go to the States to shoot in places without firearms licenses as a hobby or for entertainment. These aren't the people that perpetrate the crimes. They're health professionals, they're lawyers, politicians, they're blue-collar workers, they're ordinary citizens who have a passion for shooting, such as I do. My wife and 2 of my children are also competitive shooters, and I have 2 kids in the military. So I make a very big distinction between the illegal use of firearms and the legal use of firearms and the peaceful use of firearms, which I advocate for and which my organization advocates for. I think the illegal use of firearms and the tragedies that we see here, that I've also witnessed, this mother who has lost a child, these are the issues we need to address, not the issues that would unfairly target millions of law-abiding citizens in this country. The issues that have been spoken about here with regard to social programs, youth programs, and enforcement programs, especially the very important point that Mr. Layton brought up about straw purchases, are the issues that we should be spending money on. The other issue we should be spending money on is mental health. I work in an emergency department where we routinely have 20 to 30 psychiatric patients boarded in hallways that look like a 1950s dorm, head to foot, stretchers with security guards on either end for days on end with very little health care. And these are people that have shown up in our emergency department with suicidal ideation and intent. They don't receive the care they need. There's a huge shortfall in funding and services for these folks who are victims or potential victims of suicide by various methods. In summary, Doctors for Firearms Safety and Responsibility, we're here to educate, to put perspective on firearms, and to differentiate between the legal and illegal use of these items. Thank you very much.
Thank you very much. Are there any questions for the speaker? Director Perks.
Thank you very much for coming today, and I appreciate you telling us your story. My memory of the data is that the presence of a firearm in a home quintuples the likelihood of accidental death of a child, dramatically increases the rate of suicide, the likelihood of suicide in a household, and also increases the likelihood of domestic murder in a household. Am I correct in that?
I think not. So suicide rates in Canada have been dropping over the decades and continue to drop.
I wasn't talking about the overall
differentiating
rate.
between firearm suicide and other suicide is, I think, clouds the issue. I think the issue is that we, for instance, in my business, I've never seen, I have a family member who committed suicide by handgun, but other than that, I've never actually seen in my practice of over 30 years.
I wasn't asking about your practice. I was
Yes.
asking, doesn't the data, and we've had this presented to Toronto City Council before,
Yes.
support the claim that having a firearm in your home makes it more likely that a child will die in an accident, makes it more likely that there will be a suicide in that household, and makes it more likely that there will be a domestic murder in that household?
It is.
And if compared to a household that does not have a firearm in it. Isn't that what the overall data shows?
The overall data, unfortunately, and this is what we have to be very careful with, is you're parsing. That data is parsed from a very small data set. In other words, if you have, 5 people committing suicide and 4 of them are by handgun in a situation where you have, millions of people, then yes, you can show that there's a quintupling of rates. So if your rates quintuple and you go from, let's say as an example, 1 in 100,000, and that quintuples to 4 in 100,000, it's still 4 out of 100,000. In other words, it's an extremely low number. These are extremely rare events that you're talking about. So if you decide to parse that by saying your risk quintuples, if your risk starts out at an extremely low rate, then that quintupling of risk remains at an extremely low rate of events.
Thank you. I wonder then, given that you've acknowledged that, can you still stand by your claim that gun owners are safer than the general public?
The data does show that, and there is data to support that, yes, indeed.
Not the data we just discussed. Thank you.
You're welcome.
Thank you very much. Are there any other questions for the speaker? Director Layton.
Yes, I'm trying to learn a little bit more about this organization. Is it a member-based organization?
It's very loose. It's basically, we got together, I wrote an op-ed for the National Post outlining some of the points that I've just presented here after another group here in Toronto called for a gun ban. And so we wanted to, and instantly there was a number of people we got together through Facebook and other connections who wanted to speak up against gun bans that were motivated, we felt, by a very local situation that wouldn't be helped by gun bans.
So it's a member-based organization?
We don't sign up and don't have a membership list. We're not incorporated.
You have a list of individuals on your website. Who are they?
So we have trauma surgeons, we have ICU
But
docs.
who are they, the ones that are listed on your website? Are they
want
your
their
members? No, I'm just wondering who they are. Are they your board of directors?
We don't have a formal organization, no.
So they're
It's loose. That's what loose means.
So the 9 people are your organization, correct?
Yes,
Those 9 individuals.
Those are the core individuals. We have
they're your
other
board of
individuals that we
directors,
keep
or-
in touch with and who are on the social media thread, who are physicians, nurses, paramedics, and other healthcare professionals.
Who runs the website?
We have
one
a
of those
website
individuals?
coordinator. We have a guy who's good in IT that runs the website.
Because all of the information about who owns the URL has been redacted. So I'm just wondering who
I'm sorry,
who
you're asking
manages.
the wrong person. I'm not an IT person, and I'm not well versed in those.
So maybe you can tell me. So the leadership of the organization, how is it run?
There is no leadership. We just keep in touch, and we share information.
You have 9 individuals.
Excuse me, can I answer the question?
Well,
we have individuals who have various strengths. A couple of the individuals have presented at Senate committees and are aware of the literature and are gathering literature and share that literature with us so that we can be science and evidence-based.
So there's 9 core members of the organization, and then you have someone that does your website.
Yes.
Is that one of those 9 members, or is it a volunteer, or is it a paid person? Do you have staff?
It's a volunteer person who's good in IT.
Is it one of those 9 members?
No.
No.
No, it's an IT person who.
It's all a bit of a mystery, but there's 9 people involved.
Let me clarify in terms of expanding this. There was a petition circulated for the banning of firearms in our department at London Health Sciences. The petition received no signatures in our department, the emergency department, very busy trauma center. And in fact, I was approached by many of my colleagues in the hospital at the time, thanking us for coming out and outlining what the regulations are for firearms ownership, what the issues are for legal firearms ownership versus illegal firearms ownership. And in fact, many healthcare workers that I work with are legal firearms owners and shooters. And none of us are picking up a gun to kill anyone.
Well, we're about to hear from some emergency room physicians, so maybe you'll stick around to hear from them.
Yep, thank you.
Thank you very much. Anyone else with questions of the speaker? Seeing none. Actually, I have one final question. Sorry. Doctor? I have one final question for you, just for myself as the vice chair. Dr. Mosdossy, what is the relationship between your organization and the Canadian Sporting Arms and Ammunition Association and in general with the gun lobby?
We have no affiliations. We're literally a loose group of physicians. Let me put into perspective. As healthcare workers, if we speak up in support of firearms, in the peaceful use of firearms, the sporting use of firearms, then in fact we are vilified. One of the members that Mr. Layton has referred to was actually threatened with job action because she simply spoke up in support of her sport, which is
That wasn't my
shooting.
question. I just want to know what was the relationship between your organization, the Doctors for Firearms Safety and Responsibility, and the Canadian Sporting Arms and Ammunition Association? What's the relationship between these two organizations and your organization and the gun lobby in general?
We do not have any connections to the gun lobby.
Thank you.
We don't have any connections to the business organization that you just spoke of. In fact, I know very little about them.
Okay, thank you very much.
Thank you.